Hi, my name is Rochelle Franklin, and we're going to be performing a assessment on gas exchange for our patient Kyle Reeves. But first, hand hygiene. At least 20 seconds. Make sure that you're getting underneath your fingernails, around your wrist. Take off your watch. All right. And then, now that we're done with hand hygiene, we shall meet our patient. Hi, Kyle. My name is Rochelle. I'll be your nurse today. Can you tell me your full name and date of birth?
Kyle Reeves, September 21st, 1989.
Perfect. All right, Kyle. So tell me a little bit of what's going on. You have a slight cough, I hear?
Yes, I have a slight cough.
How long has this been going on for?
For a couple of months now.
A couple of months? Is the cough really frequent?
Yes, it is.
Yeah.
Yes.
On a daily basis, how much would you say you're coughing?
Oh, several times a day, yes.
Several times a day? Okay. On, Get out of here. Go. So, Mr. Kyle Reeves, do you feel like you have any shortness of breath?
I do.
Yeah?
I do.
Can you describe that to me? Does it feel like an elephant sitting on your chest, or how would you describe it?
It does. At times it does, yes.
Okay. And a productive cough?
Yes.
So, lots of phlegm coming up?
Yes.
Any issues with, I saw on your chart you have a history of sinusitis?
Yes.
Some inflammation?
Oh, I'm always stuffed up.
Always stuffed up?
Yes.
Yeah.
And drainage and yes.
Does that cause a headache sometimes?
Oh, yes.
Yes. How many headaches a month do you think that you have?
Oh, several, at least 5 to 10.
5 to 10. Okay, so Kyle gave us some good pointers here. One, a lot of coughing, phlegm, shortness of breath, and a chest pain associated with that shortness of breath. Some inflammation in the sinusitis area, so sinuses are inflamed, and headache, of course, is associated with that. How about any issues with your stool?
Oh, yes.
Yes. Yeah. So
it's oily.
It's oily. Any bad odors?
Oh, yes. Very smelly.
Very smelly. Would you say it's a bad smell?
Oh, yes.
Yeah.
It smells horrible.
Every single time?
Every time.
Yeah. All right. I'm sorry, Kyle. So we're going to start off with doing the rest of our exam here. That is gathering your vital signs, okay? So Kyle's vital signs is he has a slight fever. Looks like it's 101 degrees Fahrenheit. So he is running a little bit high. We may want to talk to the doctor about some antiemetics to soothe that to go down. Blood pressure was 128/89. Respirations were a little high due to the shortness of breath. We're running in the 22, and the oxygen level is around 90 due to the congestion and the issue between the exchange of oxygen and CO2. So with that being said, we also have a pulse that's also running a little high, 98. I suspect that it has to do with the labored breathing and the shortness of breath associated with the chest pain as well. And also the painful sinuses that can also cause all of those issues. So Kyle, for our last little thing, I just need you to stand up for me, or at least sit up, so that I can listen to your heart and lungs, okay?
Okay.
All right, Kyle. Thank you so much. So I'm going to start at the front of my patient. We're going to start at the clavicle region, going in a zigzag motion. My first portion is going to be right here. And you always want to listen to the skin. And then just short, deep breaths for me. actually, and I want to listen. I heard that your mom was telling me that you have a little bit of wheezing upon exhalation and inhalation. Is that correct?
Yes.
Okay. So I'm going to make sure, should be in this next zigzag line. If I hear some wheezing. And then just for, excuse me, sorry, just for some decency on the video, we are not going to show skin. And then you're going from 1, 2, 3, 4, 5, 6. And then you can also do the axillary region. And then, Kyle, do you mind standing up for me?
Sure.
Because I need to do the back. So this is going to be the back of my patient. And of course, I'm going to start up top in a zigzag region. So about here. All right, deep breath in. Deep breath in. Deep breath in. All right. Thank you so much, Kyle. I did notice some expiratory wheezes on the lower half of the lungs. So that would be consistent with our patient having a fever, some congestion. I'm worried about viral infections. I'm worried about URIs that have gone deep into the lungs, like pneumonia. But specifically for Mr. Kyle, looks like the doctor's going to diagnose him with a cystic fibrosis because this is a chronic thing that's been happening. All right. So Mr. Kyle, the only thing that I really want to counsel you on is some dietary things. What kind of diet are you having right now?
Well, I try to eat pretty healthy.
Pretty healthy?
Yeah.
Okay. Any sweets?
Oh, yeah.
Oh,
Love those sweets.
yeah, I know. Me too. But maybe we should cut down a little bit on the sweets. Make sure that you're having a good hearty meal with protein, vegetables, and a carb, okay? The protein should be as much as your fist.
Okay.
All right? And then carbs, equal to the same amount of your vegetables, but you want to get all those fibers, all those carbohydrates, especially in small, frequent meals, because cystic fibrosis does take a lot of energy from patients, because you're trying to constantly get all that phlegm up and out.
Yeah.
So we really want to focus on your diet and exercise, okay? All right. Any questions for me?
No, I'm pretty good. Thank you.
Pretty good. All right. Thanks, Mr. Kyle. I'm going to go grab the doctor, okay?
Okay.